Hi, everybody. I'm Michael Carisse, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. Our guest today, Dr. Kevin Poe, may already be familiar to many of our listeners because he's the founder of KevinMD, the web's leading platform where clinical providers, medical students, and patients share their insights and tell their stories about everything from everyday challenges to healthcare innovation to burnout and much more. The platform also features job boards, career advice, and information on healthcare employers to assist professionals in their career journeys. Launched in 2004, KevinMD receives millions of monthly page views and exceeds 250,000 followers on Facebook and X. Dr. Poe may also be familiar because he's built a national profile as a frequent commentator and expert on major outlets such as USA Today, CNN, and the New York Times. But being one of the top influencers in healthcare and medicine is just part of his story. Dr. Poe is also a practicing board-certified internal medicine physician in New Hampshire, an acclaimed keynote speaker, a communications coach, and co-author of the book Establishing, Managing, and Protecting Your Online Reputation, a social media guide for physicians and medical practices. Thanks so much for joining us today, Dr. Poe.
Thanks for having me. It's great to be here.
We always like to start with learning more about our guests. So what first got you interested in medicine and why primary care internal medicine?
I finished residency in 2002, and I'm one of the few people who's defied the statistics. And at my first job since residency, I in a internal medicine primary care practice in Nashua, New Hampshire. There's a group of 5 to 10 of us. And honestly, I wasn't quite sure what I got myself into. I think I chose primary care because I was thinking, I wasn't sure if I wanted to be a specialist, and I did internal medicine. I was well equipped for primary care, and then I went into that, and I found that it was super rewarding. And I know that there are a lot of challenges in primary care, and I know a lot of medical students find a lot of obstacles, a lot of bureaucracy that prevents them from going into primary care. But I think that primary care is an area where physicians are most needed because a lot of times primary care doctors are the entrance for a lot of patients into our healthcare system. And knowing how complicated our healthcare system is and how many obstacles there are for patients in navigating the healthcare system, it's tremendously rewarding to serve as patients' guides and help them navigate through sometimes the most difficult part of their lives and be with them as part of this journey. And that's what primary care is. It's really a journey and that long-term relationships that we have with patients. Like some of my patients, they've been with me since the very beginning when I finished residency. So that's like 23 years. And it's just so super gratifying seeing them grow along with me. And not only am I along with them on their journey, they're along with me on my medical journey as well. So for me, primary care has been tremendously gratifying and rewarding, serving as patients' guides.
That's well put and a great perspective to offer our audience. So, in the last 10, 15 years, there was all this healthcare reform, value-based care, population health, which pushed a lot of the responsibility and the hopes of improving the healthcare system on primary care providers. And I just wonder what your perspective has been on that, because part of what we hear is all the extra administrative burden and medical records and the rest of it have created a lot of burnout with the primary care workforce.
Absolutely. I think that is one of the biggest challenges that we face in healthcare today. And it's not just primary care, it's all the specialties as well. There's a term called moral injury, and that physicians want to go to help patients, but there's just so many obstacles that prevents them from doing so, and they get morally injured, and that leads to burnout and make them question why they went into medicine in the first place. And you talked about a lot of those issues that lead to that, like the administrative burden and the fact that there are just so many roadblocks that prevents physicians from giving the best care that they possibly could. I think that the latest statistics show that during the pandemic, 50% of physicians or so reported that they were burnt out. What does that mean? They found less satisfaction, and more importantly for patients, they gave worse care. So on my own podcast and on KevinMD, I share a lot of stories where physicians can, in a safe space, talk about some of those issues like burnout and moral injury. But from a patient standpoint, it's super important because if physicians are burned out, how can they give the best care that they possibly could to patients?
I'm going to get back to all of that in a second. But one other sort of career question I wanted to ask you is, did you from the beginning want to have a role as a sort of public voice, public face communicator, or how did that come about?
So I would like to say when I started KevinMD that I had a business plan, a 20-year plan, and I stuck with it. But that's definitely not the case, right? So I think that when I started the blog back in 2004, right, there were very few physicians who had that public-facing persona, and I didn't really know what to expect. And I realized that I had some influence outside of the exam room when a patient read one of my blog posts and talked about it in the exam room and said, Dr. Poe, I read your blog post this morning. I was comforted by what you had to say. And I think it was a blog post talking about a recent drug that was recalled and what it meant for them. And then that's when he realized that you could have influence, not just inside the exam room, but outside of the exam room as well. So rather than talking one-to-one with patients in the exam room, you could talk to one-to-many on social media. And as social media grew, of course, there are many, many people online, not just in medicine, but of course, outside of medicine, using that platform. There was no gatekeeper, right? You didn't have to go on network television. You didn't have to get accepted into op-ed pages on a newspaper, social media. Anyone can start a platform. And I think that's been tremendously rewarding and important for a lot of us in healthcare to have that platforms. And I'm sure we're going to talk about later why that is. But I did not have a plan, but I think that it's just knowing the power of these online platforms and the difference it can make, I think has been a learning process for me, but also tremendously important for all of us in healthcare and our patients.
So it starts with you, and then how did it grow into what it is now?
So it started with just my opinion, just on what I thought about newspaper stories, just healthcare stories every day. Patients have questions about the latest medications that were withdrawn, latest studies. They want to know what it means for them. So it started with just my opinion as a physician, giving my take on that. But then it grew into a platform as it became more visible. I had guest authors and guest posts, and I have other people across the healthcare spectrum. So they're not just physicians, but they're also medical students, they're nurses, patients, physicians from across many, many specialties, allied health professions, where they can share their perspective and their stories as well. And these stories are like pulling the curtain back on our healthcare system. A lot of them are vulnerable stories. I think I make it a point that KevinMD is a safe space for those of us in healthcare to share our stories, because there's no one else where they can share their stories. There's an extension of that, the podcast by KevinMD, where I invite authors on my podcast where they can share their own stories in their own words. And now it's become a platform that's known for a wide clinician readership, a wide readership among medical students as well. It's funny, I have a lot of medical physicians who have been reading my site since they were in medical school, right?
Oh, wow.
And it's almost like they've grown up with KevinMD along their side. And it's really one of the few places where readers can get that unvarnished view of what it's like behind the scenes of medicine today.
So what issues tend to get the most engagement on KevinMD? Plus you have these other platforms.
Yeah, so it certainly depends on what's going on in the news as well, right? So, of course, back when social media came out, it was that intersection between being online and social media and healthcare, what it meant for patients. Of course, there was COVID, right, for 3 to 4 years, where there were so many articles about COVID, the disruption in our society, the influence healthcare had on COVID. And there were so many stories from so many different viewpoints on COVID. Now we, of course, have artificial intelligence and technology about what that means in our healthcare system, not just for patients, but for medical education as well, and for physicians. And that's a tremendously exciting topic, because it really is disrupting our healthcare system. And of course, what we talked about, things like burnout, right? All the issues that prevent physicians from giving the best care that they possibly could to patients. But I know that burnout also is prevalent in medical school as well, and in medical education. That's a topic that medical educators are also grappling with. So those, I think, are the topics that really bring the most resonance on the site.
Makes sense. So as you noted before, you're a proponent of physicians having an online presence. What, in basic terms, do you see as the biggest benefits of that?
Yeah. So I think there are three reasons, right? So number one is patient education, right? Because patients, of course, are going online looking for healthcare information. Before it was, of course, people Googling their symptoms. Now they're putting their symptoms into ChatGPT, and now their AI is informing about their symptoms. But sometimes, as we all know, there's a lot of misinformation out there. There's a lot of agenda-driven information. And I can say they're not just from non-physicians as well. There's a lot of physicians out there who also, because it's so easy to have an online platform, they can have agenda-driven information as well. So I do think it's important for physicians to promote evidence-based, politically neutral healthcare information, especially today as healthcare is so politicized. So number one is that we need to share our perspective on healthcare information because patients are going online. And then if we're not online, they're going to get healthcare information from somewhere perhaps that's politically driven or simply inaccurate. So that's number one. Number two, of course, is things like online reputation, because patients not only are looking for healthcare information online, but they're Googling their doctor online. And a lot of times when doctors are being Googled, sometimes they're not going to like the information that comes up about them. If they don't have an online presence, there's going to be a third party, like these patient review sites, that's going to give them an online presence, and they're going to have no control over what's associated with their name. So it's important for them to control the narrative around their name. And the third big reason, I think, is what we talked about earlier, is advocacy about our profession, because there are just so many changes in our profession, and these changes are spearheaded by people who may not have our best interests at heart, from politicians, from administrators. So I think it's important for physicians to have that online advocacy platform where not only can we share stories, but we can also push for change from a physician-driven standpoint. So those are the three biggest reasons why I think that all of us in healthcare needs to have some type of presence online.
Yeah, and that's a lot of value, but it comes with some risks and challenges. When somebody comes to you, for example, and asks, I'm new to this, I'm worried about this, that, the other thing. What do you talk to them about in terms of the challenges and how to manage them?
So do what they're comfortable with. Everyone is going to have strengths to their personality, right? So I think if there are some of us in healthcare that are very comfortable with being on a camera, if we have some Gen Zers in medical school and they just grew up on TikTok, they're very comfortable making these videos, then continue doing that. There are some physicians who may not be comfortable on video, for instance, and they may be comfortable writing. And there are social media platforms for that. There are physicians who come from a radio background and comfortable doing podcasts and interviews. So
Right.
I think today there are just so many online platforms that suit everyone's strengths, and they'll just pick and choose what resonates with them. So that's number one. And then number two, I think that you want to start small, right? So for those who may not be familiar with just online platforms, they don't have to go full bore and go on 10 different platforms. Start small, go on a site like LinkedIn. I like LinkedIn a lot, and just put a LinkedIn profile. And I think the benefit of that is that if their names are searched online, that LinkedIn profile would show up pretty high. And then once they get comfortable with being visible online, then they could expand that footprint by going onto some of those other platforms that we talked about earlier that really resonates with what they do best. So start with something that resonates with them, whether it's video, writing, or audio, and then start small.
Are there any other risks? Well, you wrote a whole book about this, so I'm sure there's other things to talk about. Establishing, managing, protecting our online reputation, a social media guide for physicians and medical practices. So what other, just sort of in that column of concerns or possible downsides, do you talk about?
Well, number one, of course, is patient privacy, right? So I think that especially with the younger generation of healthcare professionals, they grow up with sharing things online. But I do think that the relationship that we have with patients is still sacred, and it's very easy to disclose patient-protected health information online. And even though we have so many seminars and webinars about what not to do, you still see healthcare professionals get into trouble. I think there was a major story about some urgent care center in California recently in TikTok that they just posted all this sensitive patient information on TikTok. So that's still happening. And that is still one of the biggest risks that we have out there. Just people just inadvertently oversharing things that should be protected by patient privacy law. So I think that's the biggest thing. And then number two, I think that goes into the advocacy thing. So I think that the more that you wade into politically charged topics, you have to be prepared for some pushback, right? So we live in a day and age where 50% of the people, more or less, is going to agree with what you say. And then the other half, more or less, is going to disagree with what you say. So I do think it's important to be passionate about what you believe in, but being online, you have to be prepared for some online pushback and the consequences that may entail. So that is something that if you're not prepared for that could be a risk as well.
Yeah, it's pretty intense out there online for sure. So you touched on the misinformation issue before, and it's very easy because of the algorithms, that favor engagement and, more controversial content. So it's kind of a uphill battle, I think, for the folks that are not playing that game. What approaches do you find are the most helpful in promoting accuracy and clarity?
I think you have to stick with the evidence. You have to stick with studies that back up what you're saying. I think that you should be relatively neutral politically. So I think that, again, in this day and age, some of our institutions that we traditionally thought as neutral, like the CDC, that information now is politicized. So I think that if you stick with the evidence, I think that you'll always be on safe ground. Now, that being said, I think that when it veers into opinion, people can have opinions across the political spectrum that are certainly valid. And I think that is a little bit different from some of the healthcare information that patients read. I think that it is okay to have opinion from both ends of the political aisle, because I do think when it comes to the problems in our healthcare system, I think that there are good solutions from both the left and the right. One of the things that I make a concerted effort on my site is that we need to include viewpoints from across the political spectrum. So I do make a concerted effort to have voices from both the left and the right, because even though they may not agree, that doesn't make some of their points less valid. But when it comes to straightforward health information that I want patients to consume, I think that as long as it's backed by evidence, and you could look at our professional physician organizations like the American College of Physicians, for instance, and I know that there's been some issue with the correlation between autism and Tylenol that our administrative has proposed. But then if you look at the American College of Obstetricians and Gynecologists, that would be a trustworthy source in terms of that interpretation of what the administration is doing. So I would look to our professional medical organizations sometimes for guidance when we are bombarded with healthcare information that could be politically tinged.
Yeah. From a patient education standpoint, are there a couple of red flags that you share with your patients for how to tell if something is really biased or has an agenda?
So number one is that, are they selling anything? I think that's the biggest thing. I think one of the things I said earlier is that even though information is coming from physicians, they still could be selling something. Just because a physician is online doesn't mean that they're giving reputable healthcare information. There are so many physician influencers that are out there that are selling something. It could be a product or a course, and then that is sometimes making that information suspect. So that's number one. Number two is who is paying for that information, because it's not cheap sometimes to have an online platform where millions of people can read. So you need to find out where this is funded, right? Number three is where is it coming from, right? So before I would say, .gov websites would be okay, but now that the government websites has been so politically charged, sometimes I'm going to direct them more towards professional medical organizations, like I said, the American College of Physicians, the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists. So I think that those are generally the guidelines that I share with patients. So number one, who's funding them? Number two, are they selling anything?
Those are very good tips. So Osmosis is a teaching company. We love to fill knowledge gaps, and we like to ask our guests to identify something that, they really think is a myth or something that's just misunderstood or just not talked about enough, and say, Osmosis, you guys really ought to make a video about that. What would that be for you?
So I always like to say that physicians in particular, we're more than our degrees. I think one of the reasons why physicians are burnt out today is that there's a loss of autonomy. And in medical school, for doctors to go through that path, they have to jump through a lot of hoops, right? Whether it's pre-med, medical school, internship, and residency. And there's just not a lot of boundaries being drawn. So I do think that all of us in healthcare, we need to be formally taught negotiation tactics, because if you look at a lot of the relationships that we have, not only with patients in the exam room, but with our colleagues and administrators as well, is just a series of negotiations. And I think that one of the themes that I find on my podcast when people come saying that they're burnt out is that they just don't know how to set boundaries, right? So these are just things that we can learn from places outside of medicine. There are some things that we can learn, for instance, in the business world that we could take into medicine. And that's going to help us not only be better physicians, but more importantly, it's going to prevent us from being burnt out as well. So I do think that there are some business things that we can learn that's not being taught in medical school and residency, for that matter, that's going to serve us well. So that's number one. And number two, I do think that things like personal finance, financial literacy, I do think that that's pretty important, almost as important as sometimes the medicine that we are learning as well. Because, we talk about burnout. Why are a lot of physicians leaving medicine? They're looking for side gigs, So I think that one of the reasons, again, to prevent burnout is that you don't want to be trapped in a clinical job that is making you miserable. And the reason you're trapped is because you're financially dependent on that job. So the basic financial literacy, I think, is tremendously important for all of us in healthcare, whether you're a medical student and resident. And I know that a lot of medical students aren't really thinking about that. They're just thinking about, probably all the loans that they have. But sometimes you don't want to be prisoner to your loans and be trapped in a job that's going to make you miserable and burn you out. Because if you're burnt out, no matter what the cause, you can't really treat patients.
Excellent advice. We've done 540 shows, I think, and nobody has brought up negotiating skills, and that is super important for people to have. Nobody teaches that unless you're doing a business course, right? So that's great advice. So as we wrap up here, as you know, we have a lot of students, early healthcare professionals in their audience. What's your go-to advice when you're talking to young people about starting a career in healthcare and dealing with all the challenges that come with it?
Well, it's going to sound like cliche, right? You have to do it because you love it, right? Because no one goes into medicine to make money. No one goes into medicine to make prestige. There are easier ways to do that. I think medicine is a very, very difficult path, but I think that there is no more path. No, let me say it again. I think that there is no path that is, I think that there's no path that's more rewarding than medicine, because the difference that you make in patients' lives and the difference you make in the exam room, especially today with how fragmented our healthcare system is, patients really need us. They need us not only just to be diagnosticians and to prescribe the right medicines, but they really need us as guides, because as difficult as it is for us in healthcare to navigate the system, just imagine how difficult it is for patients. You have, their insurance changes. Sometimes what's covered for their medication changes by the year. Sometimes they see a specialist one year and they can't because of insurance changes. And of course, the cost of medicine only goes up for these patients. And they're just navigating so many more hoops than we go through. And just being in a profession where we can help patients not just feel better from whatever condition, but really help them along their journey is really a privilege. And I can't really think of any other profession that comes close to that amount of responsibility.
That's a great message to end on. I want to thank Dr. Kevin Poe from KevinMD for joining us today. Really appreciate your time.
Thanks for having me. It was great.
I'm Michael Carisse. Thanks for checking out today's show. And remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelines podcast.